Principles and Learning of Teaching and Teaching, Session 5A. The objective for this week is to explore the strategies that foster and promote health maintenance for the vulnerable population. In order to do that, professional nurses must stay abreast in all areas of healthcare, from the physical aspect all the way through the political aspect. So therefore, this session is going to address some of the challenges and opportunities that nurses face in order to promote health maintenance for everyone, including the vulnerable. So let's look at some of them. According to Blaze and Hayes, first and foremost, your challenge is stay current. You have to follow the federal and state regulations in whatever state you practice. In this state, we have the Florida State Board of Nursing. Therefore, there's certain courses that we must take every year, this mandate that we must take every year in order to have our licenses renewed. In addition, there's continuing education. There's episodal, which is an individually selected educational pursuits, or you can get your educations through post-baccalaureate studies, where there's advancement in your critical thinking, or you can go on for your master's degree in any area from administration to business, and your doctoral research degree as well that allows you to understand the research process. So let's look at institutional-based education. Usually that's the orientation programs. Once you enter an institution or a place of business, orientation is paramount. Therefore, you'll be able to understand basically what's taking place at that particular facility. And then equipment updates. Whatever equipment that you have to use for your client, you need to know safely how to operate that equipment. Prepare for certification at specialties or advanced levels. So as you get more experience, maybe you want to sit for a certification in your particular area to be able to advance your specialty. And then most of the time, the intent is really to benefit that institution, but it also will benefit the client. Nurses also learn through continuing education, more specific and usually shorter than advanced academic degree study. It's usually individually driven. Sometimes it's institutional based. It just depends on where you're working. If you're at a magnet facility, there's a possibility it would be mandated by your institution. You have state and professional organizations that mandate. Some states require specific content instructions before you are relicensed. So you have your CE requirements that must be met for each state where you hold your license. And to meet certification and recertification for your specialty practices, they'll also give you some guidelines as to what you must also maintain. And then, of course, there's the episodal education that's given when maybe new things come about. So right then and there on the spot. It's distinct and separate from formal or planned education. It could be through journals or newsletters or newspapers or magazines or in each area of your job. So the process. So when you want to learn, your main focus is to change behavior. It's basically what it is. You want the desire to learn and act. You want the person to be able to have that desire to understand. So, and for an adult, a method that is used most often is called andragogy, where this is the art and science of helping adults learn. Adults have a tendency not to learn anything until they really must, and they know that it's going to be used in that particular instant. Whereas pedagogy is another discipline that is concerned with usually when we say helping children, but it really is when information is brand new, a pedagogical style of learning is also beneficial. So according to Skinner's operative conditioning theory, there's types of conditioning that takes place when one learns. One of the process is classical conditioning, where it's an association with a new stimulus. If you remember Pavlov's dog, I think we all remember that. So, and then operant conditioning, where the frequency of a response can be increased or decreased depending on the extent it is reinforced. So whatever brings pleasure many times is repeated. Reinforcement, consequences of action is there, and extinction is the process in which a conditioned behavior is then unlearned. Studies of conditioning produce laws of learning that were thought to be universal. Another way, behavior is what we want to be able to understand. So therefore, our environment begins to influence our behavior. So we have to learn how to control that particular environment that we have. Environment is an essential factor to determine human action. An act is a response that is traced to the effects of stimulus. And then there's a coding system. I often wonder how, for 5 years, you teach your children a certain method of learning and a certain method of behavior, and you send them to school for their first grade, and they come home and they have really picked up the process of learning, so that their environment has begun to change their behavior.